All right, next we're going to talk about hyperglycemic hyperosmolar syndrome. Now they call it hyperglycemic hyperosmolar non-ketotic syndrome. I don't have time for that. It is HHS. Okay. So this is similar to DKA, but there is no acidosis and no ketones. Why would that be? Why? Tell me why. They still are producing in type 2 diabetes, they still are producing insulin. It's just not great insulin, right? But they're still able to break down some glucose, so they don't have to resort to breaking down fat or protein. That's why they do not have ketones and they do not have the acidosis. So they just have D of the DKA. That's basically what this is. Okay. And hyperglycemic means high sugar, hyperosmolar. What's osmolarity? How thick your blood is. And they would have thick blood at this time because there's a lot of sugar in it. Yeah? All right. So the signs and symptoms, though, are going to look very much like DKA, but keep in mind, they're not going to have a messed up pH, right? So their blood sugar, though, will still be over 800. They're still going to have the warm skin, high serum osmolarity, polyuria, polydipsia, confusion, and blurred vision. However, this patient is going to have low potassium. Why would they have low potassium? Because in DKA, they had high potassium, right? Because that was a complete deficiency of insulin, correct? Mm-hmm. So why in this case would their potassium go low? How do they get rid of fluid? They have polyuria, do they not? It's the kidney's job to get rid of what three electrolytes? Potassium, sodium, and chloride. So when they're having polyuria, this time it's picking the potassium up with it. Okay. And then I really like this because it shows you the differences between DKA and HHS. Okay, so it's a good chart to look at. You with? Yeah. All right, something has to trigger HHS, just like something triggered DKA. What were the three triggers for DKA? Stress, illness, and corticosteroids. Okay, the number one for HHS is infection. Okay, so they get some type of infection, or maybe they stop their diabetes meds, and that doesn't always mean non-compliance. It could be that their insurance wasn't covering it anymore, or they didn't have a car ride to get to the pharmacy. There's lots of reasons why people don't take their meds, right? They were taking massive corticosteroids. It could have been prescribed by a physician, but it still put them in HHS, right? They've recently had a stroke, a PE, or an MI. That is a massive inflammatory response in your body, which caused your cortisol to skyrocket, which caused your blood sugar to skyrocket, which then caused HHS. Yeah, with? All right. How do we treat HHS? Well, we're going to start with fluids because they come in very dehydrated, right? Then we need to give them insulin. Okay. And then they're going to need potassium. Yes. What's the first thing I do if I think someone's potassium is already off? What's the first thing you do for a problem with EKG? You will always do an EKG because what's your keyword for potassium? Yeah, girl, I don't know what's up with you today. Okay. I know you know these things. Okay. All right, so we're going to do that. Keep blood glucose between 200 and 300. Why am I keeping it that high? Yeah, because you got it. You can't drop it too quickly or it causes hypoglycemia, and you're giving them IV regular insulin, right? Okay. So very important when the blood glucose gets to less than 250. This is for HHS and for DKA. We switch them to a D5 solution. What's the D in D5? Dextrose, because I don't want to bottom them out. In this case, we're going to switch them to D5.45. What does that mean? So it's 5% dextrose with half normal saline. Because if their potassium is low, that means their sodium could be high. So I don't want to give them full normal saline. I want to give them half normal saline. Does that make sense? Okay. Complications of HHS. They could have a seizure. How come? No. Oh, because sugar's not getting into the cells. I can agree with that. Yes, I can agree with that for sure. And your brain is already going to start freaking out without having readily available sugar anyway, or not enough sugar, right? Plus your blood is very thick and viscous. That's going to cause your brain vessels to kind of flip out too, causing a stroke. Okay. The patient can go into a coma. How come? Is there blood glucose in the brain cells? No. So will the brain cells die? Eventually, yes. Okay. But your blood sugar would have to be like wildly high for quite some time. Yeah. Because remember we said hyperglycemia hardly ever kill, and it's not going to kill you real quick, right? Okay. They will eventually go into shock mod's death. How come? Your kidneys died, and then all of your other organs are going to start to die too because it cannot filter this very viscous blood. Okay. Do we understand HHS? Cool.